Hi, my name's Carly Close, and this is my presentation on my evidence-based project proposal on improving dental care to improving cardiovascular health. Various research and institutions agree that coronary artery disease is the leading cause of death for Americans, and the war against the occurrence and progression of this condition is prevalent amongst all healthcare providers and healthcare institutions. It is common knowledge that the risk factors for this disease are typically poor diet, sedentary lifestyle, smoking, and alcohol use. More evidence has recently emerged that poor oral care and consequent poor dental care has also been correlated with the occurrence of cardiovascular conditions. Periodontitis, a bacterially induced inflammatory disease that destroys the connective tissue and bone that supports the teeth, can also cause systemic inflammation and lead to conditions such as CAD, diabetes, hypertension, hyperlipidemia, and atrial fibrillation, among other cardiometabolic diseases. The purpose of this evidence-based project is to assess and apply pre-established evidence of this correlation. My project also proposes a change to our clinical policies to identify poor dental health as a risk factor for these chronic diseases and improve educational interventions for our patients. Several articles were used to support my project, but I will highlight 4 here. The first was an observational study by Sauter et al. That aimed to identify a correlation between dental calculus accumulation and prevalence of angina pectoris. 1,676 participants ages 30 to 40 were followed from 1985 to 2011. An initial oral exam was given to identify dental plaque index, gingival inflammation, and calculus index. At the 2011 follow-up, another oral exam was given, plus rates of angina pectoris were measured. Of the 286 participants that were diagnosed with periodontitis in 1985, 51 of them reported angina pectoris, confirming the association. The second article examines perceptions of patients with cardiovascular disease towards oral health and challenges the potential for cardiac care clinicians to promote oral health. The study used semi-structured face-to-face interviews lasting 30 to 45 minutes to ask 12 participants questions and perceptions on topics such as the importance of oral health status and hygiene habits, barriers and facilitators of oral hygiene care, level of promotion received by the cardiac unit staff regarding dental care. The interviewers revealed that while the participants perceived oral health as important, compliance and adherence to good hygiene practices weren't maintained. The majority of patients were also unaware of the impact of poor dental hygiene on cardiac health because this education was not given in the cardiac clinic setting. This indicates a need for a practice change. Barriers to oral health were lack of awareness and socioeconomic disadvantage. These interviews identified root causes for poor dental care, which was lack of education, and how we can begin to improve the issue. The next study I used questioned the impact of oral hygiene practices on the risk, incidence, and mortality rate of cardiovascular disease, as well as type 2 diabetes and chronic kidney disease. Results found that increased toothbrushing frequency is correlated with a decrease in the incidence of cardiovascular disease and cardiovascular disease mortality risk. Toothbrushing was also correlated with rates of inflammatory markers such as CRP, which indicates a role of oral bacteria in systemic inflammation and inflammatory diseases. The fourth article I review was published in 2019 and was a cohort observational study that asked about the association between dental health and obstructive CAD, and it used multiple dental indices. 88 patients underwent either a CCTA or a cardiac catheterization to assess and identify obstructive CAD, defined as luminal stenosis of at least 50% in the left main artery or 70% in any other arteries. The participants also had dental exams to measure 7 dental markers. The results of the study indicate that there was a significant association between number of teeth lost and occurrence of CAD. The proposed practice change for this project is to include dental health and dental hygiene habits as a risk factor for poor cardiovascular outcomes. Clinicians and health advisors, such as nurses, need to educate themselves and their clients on the connection between dental disease and inflammation causing systemic effects. Dental hygiene habits should clearly be communicated in education interventions. The IOWA model is a strategy used to guide the research process by using established evidence to make a clinical change that will positively meet patient needs and organizational priorities. The model identifies a problem or trigger and decides whether it is a priority for the organization, then collaborates with the team to collect research literature until there is sufficient research to pilot the change in practice. Once it has been decided that the change is appropriate and can be adopted into clinical practice, the change is monitored and the results are disseminated. I utilize this strategy for my project because if we, as APRNs, can educate and create a plan of care to improve dental hygiene and dental hygiene habits for our clients, we can reduce the rate of cardiovascular disease, such as coronary artery disease or diabetes, and improve patient outcomes and quality of care. This may mean incorporating a team of experts to provide the best care plan and education. The recipients of the EBP change are adults ages 30 to 60 years old with generally good health and no conflicting chronic conditions that would impact the results of this study. The goal of the study is to identify the extent to which dental care impacts cardiovascular health, so individuals who have congenital or pre-existing cardiovascular conditions with a known cause will not be included. The population should be diverse in terms of age, socioeconomic status, geographic location, race, and ideally there will be an equal number of males and females so we may attain unbiased and ethical results that can be generalized to the larger range of groups and real-world settings. This EBP population should also have a diverse range of dental care habits, good and bad. We will use interviews and surveys to determine if the participants practice good dental hygiene daily, as well as have a dental hygienist assess the health status of the dental cavity. Including individuals with both good and bad hygiene practices and dental health, and then assessing their cardiovascular health, will help us determine a correlation between the two. At least 1,000 participants should be included with the goal of data saturation. Assessments will be done by providers who have had no prior relationship with the participant to eliminate conflict of interest. The population will be collected with a random sampling methodology using confidential, HIPAA-compliant emailing system sent out to clinic patients for recruitment. The proposed setting for this project is a cardiovascular clinic and partnering dental clinic and cardiac cath lab unit in a large hospital in the Utah, Colorado, and Wyoming areas. Participants will be individually interviewed at the cardiovascular clinic. Dental and cardiovascular assessments will be completed at the dental clinic and cardiac cath lab unit in the hospital. Ethical considerations for this project include maintaining confidentiality and ensuring no harm, physical or psychological, comes to the participants through the examinations. The reason why this is an observational study is because any intervention that would have participants practice bad oral hygiene habits may cause poor health outcomes for them in the future, and thus not adhere to the ethical principle of non-maleficence. The primary outcomes of interest for this project are rates of cardiovascular disease and the negative cardiovascular events. They are the dependent variables in my study. I am testing to see what impact dental hygiene has on cardiovascular health. Another outcome or goal is an increase in the amount of education about dental health related to cardiovascular disease received by clients from healthcare workers. I will measure the success of my practice change with follow-up interviews with individuals that identify increased education and awareness of the impact of dental care on cardiovascular health and identification of poor oral health as a risk factor for cardiovascular disease and cardiovascular events. Common tools to assess cardiovascular health are blood tests, EKGs, stress tests, imaging procedures, and risk calculators. In my study, I will use CCTAs, cardiac catheterization, and the ASCVD risk estimator as my data collection methods. This method of this project ensures this reliability and validity. The significance of this topic and project for nursing includes its promotion and education and good health outcomes for clients, as well as improving the nurse-patient relationships. After completion and evaluation of my project, I will submit my findings to a reputable journal to be published for public knowledge and incorporation into practice. Education strategies will be organized and provided to healthcare institutions, including follow-up interviews with healthcare workers to ensure they understand and are successfully incorporating the practice change. The dissemination and sharing of findings are crucial for progression and improvements to healthcare systems and patient outcomes.